My name is Alex and I am an exercise physiologist. The primary objective of pulmonary rehabilitation is to improve exercise tolerance and improve quality of life.
Our patients will have long-term lung conditions such as asthma, COPD, bronchiectasis and ILD.
We have an initial assessment. The patient has an appointment where we assess the patient's exercise needs. We make a personalized program for them, so our goals have been set for the program.
They will then start a 6-week program consisting of 2 supervised sessions a week. The first hour consists of exercise and then it's followed by an education session.
We find education is important in managing the respiratory condition. We go into detail about the inhaler techniques, how to manage their anxiety, diet, because most of the respiratory patients have low BMI, airway clearance to help them clear the chest so that they don't get frequent chest infections.
Throughout the program, they will receive supports and be monitored to ensure they stay on track. We do various exercises helping improve their strength as well as flexibility, balance and their endurance.
A patient with a respiratory condition has complex needs, so therefore we emphasize on a multidisciplinary team approach. It involves respiratory physiotherapists, COPD specialist nurse or respiratory specialist nurse, rehabilitation assistants, exercise physiologists and dietitian and occupational therapists. It's a collective treatment rather than just a specific treatment.
Following the completion of the program, they will then do a post-assessment and this will help them have that guidance on how to maintain their great qualities that they've achieved from the program.
It was difficult when I first found out about the condition because all my life I've generally been fit. I've run marathons all around the world. I've played professional sport. One day I was running for a bus and I couldn't go after the bus as I normally would do. I thought something was wrong.
My wife and I were going out to dinner with friends. I was pushing my food around the plate, couldn't eat it. Something was telling me that I didn't want to walk home. I started to walk up the hill. It's only 150 yards. And I said to her that I've got to walk on ahead if that was all right. She found me slumped over the boot of the car. Couldn't breathe. I was gasping for breath. And an hour later, she called an ambulance.
I used to fly to the States quite a lot to see my family over there. And then was told I'd have to have a fit to fly examination. And all of a sudden it felt like my life was changing.
The main symptom associated with having a respiratory condition is that you become very breathless on exertion and sometimes even at rest. This can also affect how you go about your daily life. You might find that you avoid doing certain activities that make you breathless, avoid going for walks and socialising.
It hinders so much that you want to do, but you cannot. I found it very hard to do anything at one stage, getting out of bed even.
A lot of the goals that patients have coming to us are things like playing with their grandchildren, gardening, seeing friends and family, or having reduced breathlessness when they're out walking.
With always, I guess, having a level of fitness, I just went out of the daytime, tried to do some running, tried to do some weights. I wanted something which was going to give me some kind of direction.
I was desperate. I was looking for something to do that would make me feel better. And that I did find. The course I did at the Dolphin Centre was up to 8 people in a session. And there was about 12 different items of exercise, which was absolutely brilliant for me.
I mean, the physios in all of the sessions that I've been to have always been wonderful. And they all have different ways of showing you how to stay well.
I just felt so much better when I was able to get out and about an awful lot more, socialise an awful lot more, and going back to being my old self again.
I just felt better. My everyday sense was better. Rather than strolling up and down to town, I could walk or even trot to town.
I have a 3-year-old grandson who is just such a bundle of fun. I can now play with my grandson. I would recommend anyone to have a grandson like him. Very lucky that there's been a fabulous team behind me. It's just been a marvellous road that I've travelled up to get to where I am today.
I miss it because I think it gives you that direction of how to go forward.
The staff have been absolutely unbelievable. They put me right, and I'm forever grateful.
I am proud to be a respiratory physiotherapist because I can improve people's life.
This role is extremely rewarding, being able to closely support the needs of our patients. It's not only the clinicians that help motivate the patients, but it's all the patients helping, encouraging one another. It's a really positive environment, and I think that's really crucial. If you want information about the Pulmonary Rehabilitation programme, you can speak to your GP or practice nurse.
Just try it, because you'll know the difference. I did.
My wife says the National Health Service is greatest. I'm inclined to agree with her.